Mr. Speaker, I rise to support reauthorization of my Newborn Screening Saves Lives Act, which I first introduced in 2002. Let me begin by extending my sincere gratitude to Congressman Mike Simpson for our 15-year partnership championing newborn screening. Many thanks to Congresswoman Catherine Clark and Jamie Herrera Butler, who this year joined us as House champions. And my heartfelt appreciation to the coalition of public health groups who continue to support my newborn screening efforts, especially the March of Dimes and the APHL. Newborn screening involves a baby receiving a simple blood test to identify life-threatening diseases before symptoms begin. Prior to the first newborn screening test being developed, these children would have died or suffered lifelong disabilities. And until enactment of my original newborn screening bill in 2008, newborn screenings and access to follow-up information were not consistent and available to families in all communities. At that time, only 10 states and the District of Columbia required infants to be screened for a complete panel of recommended disorders, and there was no federal repository of information on the diseases. Today, 49 states and D.C. require screening of at least 31 of the 35 core treatable conditions, and a national clearinghouse of newborn screening information is available for parents and professionals. Rapid identification and treatment make the difference between health and disability, or even life and death, for the approximately 12,000 babies who each year test positive for one of these serious conditions. In addition, this simple test saves our healthcare system millions of dollars in care for each child who's identified and treated early. This truly public health success story exemplifies what can be accomplished when private and public institutions, industry, advocates, scientists, providers, and parents partner to ensure a healthier future for our children. Mr. Speaker, to maintain and advance the incredible progress that we have made over the last decade, we must reauthorize the Newborn Screening Saves Lives Act. Passing H.R. 2507 will ensure the Advisory Committee continues its critical work of recommending new screenings to state programs. It will guarantee access to the most current follow-up programs and educational materials for parents and providers, as well as high-quality technical assistance for state programs and public health labs. Reauthorization will also commission a National Academies of Science study to make recommendations for a 21st century newborn screening system. Mr. Speaker, I urge a yes vote on the passage of H.R. 2507 to ensure all our newborns receive a comprehensive and consistent testing and follow-up that they will need for a healthy and productive life. I yield back. Thank you.